Welcome back. And now universal healthcare remains a controversial issue in South Africa, with the nation working towards universal health coverage through its national health insurance system. Today we reflect on the progress made in advancing healthcare access and quality in South Africa. And joining us with more insights on how more progress could be achieved is Momentum Health's Chief Marketing Officer, Damian McHugh. Thank you so much for your time, Damian. Let's actually start off with the vision of healthcare that we should actually be working towards in South Africa.
Thanks for having me, Zanotti, and happy December to all of your viewers. I think the vision for healthcare in South Africa is a very simple one. We want more people to have more access to quality healthcare and hopefully at a price that's affordable to all, to everybody. So communities, when they require healthcare, to have access to healthcare, access to quality healthcare at a price that's not just maybe affordable to them if they're paying for it themselves, but affordable to our country if we are paying for it as an economy. So I think that would be the vision for our country going forward. Our purpose at Momentum, and not that I want to use this as a measure for it, but more health for more South Africans for less. I think that would be a great way of explaining it.
Are all stakeholders kind of clear on the barriers, but also that agenda that we should have as a country in advancing our healthcare system?
I think we're all clear on what needs to be done. Yes. I think we're all clear on what the ultimate vision looks like. I think it's the steps of us getting there, I think, is where some of the differences may sit. But it's not, I don't think any of them are insurmountable. I think all of us know that we are facing economic barriers in South Africa. We have high unemployment. We have lots of people who have more and lots of people who have less. We've got some of the biggest, disparities between the people that have and the people that don't, in the world, in our country. And I don't think that's any different in a healthcare context either. In a healthcare context, we've got people on private healthcare cover who have access to good quality healthcare and a very hospice-centric, specialist-centric sort of care. And we've got people in South Africa who don't have access to good quality healthcare. And those are things that we need to address. I think, we can't have only 8 million of our South African people or 9 million people, covered by private healthcare systems and the rest having challenges to get access to quality healthcare. It's just not sustainable in the long term. So we need to address, I think all of us, private and public sector, know that we have to address those. And it's now about taking those steps in the right direction to be able to achieve the objectives that improve healthcare for all of us.
Well, let's actually talk about that. I mean, what kind of partnerships and models should be sought and fostered in this effort?
I think the public-private partnerships are some of the key ones that we need to get right. And sometimes we focus on the negativity that exists within our healthcare sector, but let's also focus on some of the positive things that have happened in our healthcare sector. I think we are the largest antiretroviral therapy treatment that that the government does in the world. So we're the best at getting HIV treatment out to our South Africans in the world. We've built over 1,500 healthcare and primary healthcare clinics in the last sort of decade and just over a decade. So there's lots of positive things that are happening in our system. It's a question of how we can help public and private working together. So there's still, if you look at South Africa, we've got 9 million people, we've got about 16 million people, 18 million people formally employed. About 8 million of those are covered, another 6 to 8 million who are uncovered. Could we, as the private healthcare sector, be better at delivering healthcare solutions that allow those members to be covered in a private setting where already hospitals, doctors' rooms and things are already built? That 8 million people take some burden off the state. It allows the state coffers to spread further over those people who aren't employed. And so I think there are ways in which we can do it. I mean, we as, and not just us, but as the private healthcare sector, not just Momentum, but other organizations as well, partner with in education contexts, partner, because we see other challenges as well. I mean, it's just, talk about some of the other things, the advent of AI, the advent of telemedicine, those types of things aren't yet taught in our, sort of health schools, whether it's public or private, tertiary education, whatever. That's not yet taught. So you, as a doctor, as a nurse, as a healthcare practitioner,
and I was actually,
work on those things.
And I was actually going to ask you, Damian, I mean, how much room do we have for innovation in this space?
Sure, if we don't innovate in this space, people die. That's the bottom line. So, if you think about South Africa again, the history, the first open heart transplant in South Africa. So innovation exists in a healthcare sector in South Africa. And in fact, one of the very key things, when I was traveling a little bit this year, chatting to some people in America and the UK, they were talking a little bit about how innovation in a universal healthcare system or national healthcare system sometimes isn't great because you're focusing on cost cutting and you're focusing on making sure, and rightly so, right? You're focusing on making sure that healthcare is delivered at its best possible price. Some of the things that you miss out on is the innovative technologies that may exist in order to improve health outcomes. And that's why the public-private partnerships are so valuable, is because you can then take some of the innovations, and let's be honest, the first open heart transplant wasn't done in a private setting, it was done in a public setting, but we've learned and we've moved. And I think the ability to transfer knowledge between the two sectors is absolutely critical to the improvement of health in our country. So it's those elements which we mustn't lose. There's lots of ways in which public and private partnerships can work together to make healthcare better. I mean, we've done it in COVID, we've done it in HIV. There's lots of different ways that the sector can help in education. Both sectors can work together to improve health outcomes for sure.
All right. Well, thank you so much for your time and giving us your insights there, Damian. Really, really appreciate it. That was Damian McHugh, Chief Marketing Officer of Momentum Health.